Doctor, is one reason that you would give heparin that it acts with speed? It acts almost immediately. Do you agree that the patient, I think Dr. Schramm said, that there was some sort of physiology or pathology in the popliteus which would indicate a bad condition, and that this was likely to be the source of the obstructions that were found up in his lung? That's correct. Let's say that there was treatment at midnight on January 18th, 2002. What would the heparin have done for any of the obstructions in his tissue? Can you tell us that? Absolutely nothing, I'd say. What would the heparin have done for the enlarged heart? Absolutely nothing. That would not have affected it at all, the enlarged liver? Absolutely nothing. How about the enlarged spleen? Nothing. Defendant's counsel, I object to this constant leading, Your Honor. The court, no, overruled. To your knowledge, has heparin been called a miraculous drug? I have never heard that used for it. But it may stop further emboli, may it not, from passing? Is that the intent? Is it your view, doctor, that that is the intent or not? It simply prevents further thrombus formation in the veins of the tibia, which, of course, is something to be looked for and to be observed. But it subsequently could cause problems. Is there medication that you can give that will eradicate, I suppose you could say, that will take away the clots that are in the vasculature? Defendant's counsel, Your Honor, may I have a brief voir dire on this area? The court, no, you may not, counsel. Doctor, what is the name of the last patient you treated for this condition? Defendant's counsel, Judge, I object. The court, that is for cross-examination. Plaintiff's counsel, if we are now going to talk about what treatment this doctor renders, this doctor does not treat people, Your Honor. Defendant's counsel, Your Honor, he has a chair in cardiology and orthopedics in Columbia University. He is a full professor of cardiology. The court, he is qualified as a pathologist and he can relate treatment to the area he speaks of. That is all, Mr. Bloom. Defendant's counsel, all right, I will wait. Plaintiff's counsel, I just want to point out, Judge, that counsel has four different textbooks on the table directly with the names facing the jury. I submit that is inflammatory and unkind. The court, it is not necessary for you to comment on them. Defendant's counsel, is that appropriate and apposite? Plaintiff's counsel, do you want me to put them down? Defendant's counsel, you can leave them. Doctor, is there some medical treatment in 2002 that was available to clear up these emboli that were in the vasculature, that were in every pulmonary vessel, I think you said, in the 5 lobes of his lungs? Was there any medicine that could wash those away? Defendant's counsel, I object to the whole line of inquiry, Your Honor. The court, sustained as to the last question. Doctor, there are medications that can help the patient. Are there not? A patient such as with this condition? There are. These are different types of drugs that are used for dissolving acutely obstructing thrombi in the vessels, as I recall. They have been used almost exclusively with good effect in arterial thrombi. Doctor, I am not asking you about arterial thrombi specifically. Very well. Doctor, do you have an opinion with a reasonable degree of medical certainty as to Mr. Jackson's prognosis given his status on January 18th, 2002, assuming that he got perfect treatment, assuming that he got the finest medical treatment extant? Yes, I do. That is your opinion, sir? That he had less than a 2% chance of living up to 1 year after this episode is exact. That is the basis of your opinion, sir? You're asking what is? Yes, what is? Because he had evidence of irreversible heart disease as well as irreversible lung disease as a combination, in addition to which he had damage to the left ventricle combined with the liver disease, the severe enlargement of the heart, and the obstruction of the lung circulation, which had occurred over a period of time, all of which were irreversible, associated with either the development of untreatable heart failure, and most often the development of sudden arrhythmic death in the usual course. Defense counsel, move to strike, Your Honor. The court overruled. Doctor, in what way does the right and left, or just the right, come involved? Both the right and the left were enlarged. The total weight of the heart was 630 grams. 630 grams? That is correct. That is my estimate of the weight. Now, let me ask you this, doctor. You had mentioned left heart disease. Was there evidence microscopically of left heart disease? Yes, there was. Can you explain that to the jury? And would it be helpful for them to see some of the slides? We have made arrangements so the jury can see some of the pathology in this case. I believe so. Yes, I can explain it first. The left ventricle showed evidence of enlargement of the cells, as well so that there was so-called hypertrophy. The court, what does that word mean, doctor? Hypertrophy means enlarged size. The heart cells, what you are born with at birth, is all the cells you ever have. And so the only way that the heart enlarges, either in proportion to the body size up to a certain level or in response to disease, is for those cells to enlarge ipso facto. Continue, doctor, but in addition to enlargement, there are other changes that were contraindicated of the presence of pathology or damage and disease in the heart muscle. The left heart showed a degree of evidence of scarring between and around some of those heart cells that I mentioned, and this is an indication of chronic damage to the heart. The weight of the heart is indicative of a large heart. Doctor, how does that affect his prognosis? The fact that he has left heart disease, doctor, in addition to the right heart disease? That's another significant first factor or association with a poor prognosis. In other words, enlargement of the left heart alone, even in the absence of left heart disease and right heart disease, is a major cause of heart failure and a major cause of sudden death due to electrical irritability of the heart.
Too fast.
Well, whoever takes these will get a run for it. Right?